The voice of truth tells me a different story. I will choose to listen and believe the voice of truth.
Okay, welcome to your advanced healthcare class. Tonight we're going to be talking about 3 ways on how to get a nervous system or how to do a nervous system centered workout. So it's amazing what happens. And so the juicy stuff for me is when that health change turns into a life change. And that's what we're about here. That's what we're about here. So how many people know somebody right now that's on an antidepressant, anti-anxiety medication? How many people know somebody next to them at work, next to a church pew, a neighbor that's overweight? How many people know somebody on a medication right now? So those are the people that you need to enroll in a new possibility related to their health, because if you're not planting seeds now, guys, I'm going to be harsh for a minute, you're killing them. Because you have new knowledge that could change somebody's life and you're withholding it. You're withholding it. That's a little selfish if you think about it, right? And if it's something where you don't know what to say, just say, hey, you know what? I've had this thing that blessed me and now I want to bless you. Come to this class. It's not about me. It's not about my clinic. It's about planting seeds so they make a different decision. You get that? So they make a different decision. Come on in. And when they make that different decision, the blessing behind that is it's gonna unfold for you, because later on they're gonna say, you know what, Valerie, Jonah, Kristen, Rebecca, Donise, they took a stand for me related to my health, and you know what? I've changed my life. That's who they remember. You know, when people get saved in here and they're a practice member here, notice how I don't say patient because it means to suffer in Greek. I don't want anybody suffering around here. When you guys get saved and you come in here, about 99.9% of the time, you know what people tell me? You know what practice members tell me? If it hadn't been for Chevy or Caden or Dr. Tanya or Candace or some of the people we've had in the past or Allison or whoever it was, right? If it hadn't been for them taking a stand for me, I wouldn't be here right now. Because I was going to walk right past that booth, or I wasn't going to sign up for the appointment after you gave that health class, or I wasn't going to sign up for the appointment after you did that talk at my work. But I decided to. And that's what happens, guys. And when that happens, you release more dopamine and serotonin. Anybody been in line at Starbucks and like everybody's heard of a random act of kindness, right? So when you do a random act of kindness, hey, Gopal, you know, or excuse me, sir, what's your name? Oh, my name's Gopal. Oh, hey, my name's Cordie. How are you? Can I buy you a cup of coffee?
Sure.
Yeah, sure. And then you want to punch him in the face? No, it's a random act of kindness. You don't get mad at him after you do that. It makes him feel good, and what do you feel internally? You feel good too, right? You're not like angry after you do that. So that's what I mean. That's what it's all about. So, kind lady, would you please? Because I'm going to need you pretty soon anyway, so I might as well just use you for this part. So let's have you stand right here. And I'll pull this back. I'll probably move it a million more times. Okay. So when we talk arm rotations, all right, what we're going to be talking about is 3 different movement patterns. So you can see there on your sheet the top 3 ways that you can get a nervous system centered workout. The first one is arm rotation, internal, external, and neutral. The second is core activation. The third is going to be listening to your body, okay? And so we're going to break down arm rotation, and after we break down these 3 things, I'm going to relate it to several different workouts and examples of what a nervous system-based workout would look like in your life. Arm rotation. Why would you guys think that arm rotation might be a negative factor in building muscle, training, anything like that? How could arm rotation be kind of a negative component to us getting the goals and meeting the goals that we want to meet?
Range of motion.
Okay, definitely. Okay, range of motion. What else?
Nerves.
Potentially nerves, right? And when we talk arm rotation, what are we talking about? Well, there's 3 different types of arm rotation. Vanna, please, ma'am. So this is neutral. Everybody notice how her hands are along her kind of trouser seams? That's like a Marine Corps term if you want to see that. Jordan, can you see okay? Maybe turn to the side, please. Miss Amanda. Okay, notice how her hands are along her trouser seams like this. Now, we could go, and I'll show you 2 different views, me and Amanda. This would be internal, right? So go ahead and go internal, Miss Amanda. Thank you, ma'am. That would be internal. And then the last one would be external. So this is external rotation, right? Is out like that. Now, which one do you think would be better for the nervous system? External, neutral, internal? Neutral. Okay, neutral would be one. Okay, there's two answers. See, it's like a board exam when we work on our boards. The ones that you have to choose the best one that's right. Right? Okay, so external, and then what? Neutral, right? So we got two right answers, neutral and external. If I go internal, what way is my curve going to go? Is it going to come back into a banana, or is it going to crush the brainstem? Yeah. So if I do internal, it's constantly doing that. So why is that important? Think about some movement patterns right now where you're just solely doing internal movements.
Computer.
Okay, computer. What about in the gym? What's that?
I said driving, but you're
driving. Yeah, you guys are right. Okay, so I like that. Beautiful, Caroline Dooley. So let's stay on that since Caroline started that. Let's do that. So we got driving, we got keyboard. What else? Well, and we'll get to that in a minute. Since I was going to go gym and then we went elsewhere. So I want to stay on that vein and then we'll go to the gym. So
I like shoulder workouts, bench press workouts.
Okay.
No.
Okay, so we're going to stay away from the gym just for a second. Just for a second. Well, that was what we were originally going to do, but now we're going down. So stuff you do around the house, or stuff you might, like driving a car. Lawnmower would be internal. Does everybody get that?
Dishes, TV.
Dishes, could be, maybe, depending on what way you turn the dish. Yeah, I guess. If you're scrubbing, yeah. Sweeping, could be. Yeah, if you're going like that, that's going to be a little internal. Now let's relate it to the gym. But absolutely, so some top ones that I kind of heard that we're doing frequently that we would do for long periods of time would definitely be a keyboard. It would also definitely be driving. So how could we kind of change the driving part of things? How could we alter that? Because anything you do for a long period of time, right, is going to create that, what we call micro trauma. So how could we kind of mitigate that circumstance and change that?
Hold your hands on the steering wheel.
Yeah, beautiful. Dr. Williams does that all the time. I do the side or one hand like this or whatever, right? So it's constantly changing that. It's going to allow the body to adapt and be in a different place. Keyboard. There's not really any way you could really change the keyboard other than one of the things I recommend in the posture video that we did about a year ago or something like that is to have the keyboard, try to get a wireless keyboard, have it on your lap, okay? And don't worry about tumors or anything. If it's batteries, as far as I know, you're not going to get any tumors. They'll probably come out with something like 10 years from now. Dr. Williams told me there were no tumors, and now batteries are going to create a tumor. Who knows, right? But you can go on your lap, get the monitor up, right? And then if you don't have what am I thinking of? Armrests, then you'll be in relatively good shape. You're still internal, but the shoulders are going to be relaxed. So you're not as internal as if, right? If my keyboard's way up here, am I really internal? Everybody see how now the shoulders are flopping back? So what are we talking about? Neutral, internal, external. Everybody get that? So there's two things. When you do rotation at the arm, the rotation at the shoulder joint influences what's happening at the wrist and the hand. Everybody get that? Mm-hmm. So this is a multi-axial joint, meaning it can move in all these different directions. That's why it can so easily get dislocated. You get that? So when we go internal, if I'm going internal and my hands are here, everybody see how now when I extend my arms go more internal versus right here, they're relatively neutral, right, in my arm bone, but they get a little internal around my hands. But it would be better to be this way than this way. Everybody see that? So that's why we wouldn't want a desk that's way up there, and I'm such a stickler about you getting those kind of wireless keyboards or keyboards with batteries. Okay, so now we'll go to the exciting part, the part that everybody wanted to go to. So now gym. So we had shoulder, if you're doing shoulder press, what is this? Dumbbells. It's going to be external, absolutely right. This is external. Now what if I were doing a chest press this way with dumbbells? Neutral. Okay. Now, what if I'm doing a dumbbell chest press this way, or what if I'm doing a barbell press this way? Everybody get that? So if you're confused, just bring your arms down and see where your arms lie. And that should universally work. Somebody will create one scenario where that doesn't work, and then I'll have to explain myself. But generally speaking, If you're going internal, you put your arms down, your arms are still internal. You get that? Because where are my thumbs? My thumbs are kind of pointing in. If my thumbs are parallel to my trouser seams, I'm neutral. Is anybody totally lost and wants to like go like sit in the room by themselves in the dark by the x-ray machine? Okay, good. Awesome. Maybe you're feeling that way. All right, cool. Got a good laugh out of that. Everybody was like sour pusses tonight, man. Everybody's quiet. It's Monday, right? It's supposed to be Monday fun day. Yeah, see, we always alternate Mondays, but Mondays yield the lowest turnout. But years ago, somebody's like, why can't you do it on this day? Why can't you do it on this day? So I switch in the hopes that that one person that always complained will come on the days that I switch it to try to accommodate everybody. So we just have to do that. Well, maybe it works, maybe it doesn't. I don't know. There's probably one person in here that can only come on Mondays, and we're blessing those people for this year anyways. 2019 might hold a different thing. Maybe we'll do that monkey survey, whatever it's called, monkey deal.
Monkey?
Yeah, surge monkey.
Survey monkey.
Survey monkey, we'll do that. Maybe we'll do survey monkey next time. So we got internal, we got external, we got internal, we got external, and we got neutral. Everybody feel pretty good about that? Can we move on? Yeah. Okay, cool. And we'll go to different workouts related to that. Now, this is where I need Miss Amanda. Get a free adjustment. Face up, please. Woohoo! So the second part we're going to talk about is core activation. And if you can't see, say something. We will have questions today. I won't mow over the questions. Sometimes I kind of mow past the questions. Anybody notice that? We just skip and we never do a question and answer period. Okay, so we got to write short. So if we got to write short, I always check that side first, and it's all tender. She looked like Thumper from Bambi. Squinting there a little bit. Yep, and it's an atlas. So here we go. There's the atlas. Can subluxations be released and it not make a sound? Yes. Absolutely, beautiful. Definitely made a sound, yes. We're just kind of sharing. Sometimes it won't, but that's cool. You evidently really like the sound. That's okay. See, we embarrassed her now. Sorry.
I like the sound. It's cool.
It's cool. Well, there you go. Right? There you go. Okay. So, core activation, scapula traction down, low ab engagement, neck traction or length. Why did I put that in there? So we've got three basic fundamentals that we're talking about related to you doing a nervous system centered workout. The first one is arm rotation. Where your arms are when you're working out, what are we talking about? Obviously with weights or certain movement patterns you do, right? The second point is core activation. What's your core doing? Like when I'm moving through certain exercises, a lot of you, when you're doing exercises in the gym, you're like Elvis pelvis and moving around like a jelly bean. You have no clue what your body's doing. You have no clue what your body's doing. And believe it or not, when I was bodybuilding, I got this. The first time I ever started thinking about this was, I forget what it's called. I actually think it was from Arnold Schwarzenegger. He has a book called the Encyclopedia of Bodybuilding. It's like, if you're a young kid, man, it's like the book of gods amongst bodybuilding or building muscle. It's like that thick. And I got this from him because one of the things Arnie was talking about, the governor, one of the things he was talking about is whenever he would do a movement, he would clench and bring in his abs, his upper, lower, and middle abs. The entire time he's doing a movement. And I went on as I started working on NFL athletes and participating in Pilates and all this different stuff, really learning the importance of that, but also learning where people were really misguided with that. Like really misguided, like from PTs to doctors to trainers, where people they say core activation and they really don't know what that means. Okay? So I'm going to try, hopefully you guys can see here. And I'm going to try to explain it the best I can. I would also encourage you to, when the video comes out, you guys can watch it and rewatch it and really see what we're doing up here, okay? But see, that's the other reason why you got to be here, because you can't ask questions from Facebook, right? You just can't. It's pretty hard to do that. At any rate, no, you're not doing sit-ups. Don't worry about that. I would have told you to put on some, yeah, I wouldn't have done that to you. But what you are going to do is we're going to start with scapula traction. So what does that mean? When we talk scapula traction, your scapulas are your shoulder blades. That's all they are. And there's these tiny muscles right here on the side, basically the side under your armpit is the simplest way I can explain it. I could say the dorsal scapular nerve, right? Because if you guys see it on Google or Wikipedia or in a book, man, it's like the gospel, right? But this is the dorsal scapular nerve, right? And these are the intercostals. And right here is an area called your serratus anterior. Serratus anterior. Now, I'm being very vague right here. So if we want insertion points or origins or anybody on Facebook, relax, okay? We're just being vague here. But you're going to integrate that serratus anterior, okay? Because some of my doctor friends, they'll be on there. That's not where it is, doc, right? So you got to police yourself in this, in this world we live in now. But at any rate, so the serratus anterior is right here. And when we drop the scapula down, what it does is it allows us to start integrating the abdominals here. Anybody ever seen a gentleman or lady do a push-up at the gym and their scapulas flare out and they look like a weird animal from like a gargoyle cartoon or something? Anybody know what I'm talking about? Don't say it if you can leave me hanging again. You guys left me hanging earlier, so it's okay. You don't have to appease me. No. So what happens is sometimes when people are doing push-ups, you'll see the scapulas really flare out. Or they'll like flare up like wings on a bird. That is an unstable shoulder girdle, and that is an unstable lower back, unstable abdomen. 99% of the time that's going to be the case. Because when the shoulder blades drop down, it allows you to integrate the abdominals. So when we talk about core activation, and I would encourage you beyond this, if you don't understand this, because it's some really complex subtleties, but I had to mention it and get the conversation going between all of us so you guys would independently research it and we could talk about it, because some of you think you're doing core activation and all you're doing is going into your lower back when you're training. You get that? And CrossFit, some of you guys are doing it out there, and I want you to be really, really careful with that stuff. We're going to talk about proper interval training in a second, but a lot of times, I got CrossFitters in here, no hard feelings. Somebody's on Facebook right now, mad at me like the vegetarians are sometimes, and all I'm trying to say is some of you are you're doing movement patterns that are made for Tyson Clabo, who used to play for the Falcons that I used to work on. You're doing gross movement patterns that are erratic, and you're in your 50s and you're trying to keep up with somebody that's in their 20s and is a bodybuilder, and there's not enough knowledge about the movement patterns, and there's not enough knowledge about whether that movement pattern works for your body or not. You get that? So scapulas are going to be down, okay? So scapulas would slide down, and that's a subtle thing. So all you're doing is you're pulling the scapulas downward. You're going to feel the back of that shoulder blade. Everybody knows where the tip of their shoulder blade is, right? If you go like this with your thumbs, you can feel the bottom of the shoulder blade. Yeah. You want to set the intention. It's not a physical thing like my guys are going to go, ugh, like they're having a bowel movement, right? It's not like that. You're just lightly gliding and sliding those scapulas downward. You're setting the intention. You get that? As you set that intention for those shoulder blades or scapulas to glide down, you're going to feel a lot of length in your neck. How many people have been corrected by me on traction, and I told you to bring your chin back like that, and then some of you are like this, and you look like a weird sardine or penguin. And I tell you to bring the chin back and relax the traps, right? I sounded all nasally when I said that. How many people have been corrected that way? Yeah, because you're not relaxing your traps, so it's the subtlety of movement. In Pilates and work I used to do with Bob Cooley, we would talk about the subtlety of the movement. Movement patterns should be like the ocean. There's an ebb and flow to it. The guys that get hurt, again, it's the guys having a bowel movement when they're doing a bench press. You know what I mean? There's no breath and there's no subtlety of movement there. You get that? There's got to be an ebb and flow with the movement. It's got to be an ebb and flow. So yes, we want tension, but we want tension with ease. You get that? We want tension with ease, okay? So really important. And what does that look like? Well, if you're a man, that's harder for you. If you're a woman, typically it's easier for you. But for everybody, that takes kind of you going within when you work out and just kind of experimenting with that. You get that? When I was in the Marine Corps, it was all force, 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 force. And pretty soon as you get older and you're my age, you figure out that, or maybe people that are older than me, you figure out that that doesn't necessarily work. Doesn't necessarily work to lead a result in the gym or even a result in life. Forcing and controlling doesn't. So we're going to slide the scapulas down. And then what you're gonna do is, you know how you start to hold and bring in the abs? You start to kind of come down in your abs, and women, you would identify this as your Kegel muscles or your pelvic floor. Anybody that's been on a long car ride can identify this because you're holding your urine stream so you don't urinate everywhere, because dad's one of those people, like my dad's was, we're driving like 6 hours and we're stopping once, we gotta make the time, right? And you're, right? You're flying and everybody's like thinking about peeing in a cup or something in the back seat, right? So that muscle, that's that lower pelvic floor. That's gonna engage those lower abs, and that's the only way I can say it. And when you do that, everybody stand up for a minute. Sorry, Jordan. Everybody stand up for a minute, okay? And if you can, what I'd ask you to do is just move to your right just a little bit, Bill, because you are a very spacious window. Love you. This guy's what are you, 6'4"? Bill's a loving, sweet man, 6'4". I got two like 6'3", 6'4" guys. When I go to hug him, I'm right at chest level. It's really embarrassing. I feel like a little kid, you know what I mean? So at any rate, I had to embarrass you for a second, Bill. So we got our scapula sliding down. The neck is nice and relaxed, okay? A lot of length in the neck. And now what we're all gonna feel subtly is like we're kind of engaging our pelvic floor. So what that's gonna feel like is just kind of subtly feel. Notice how I said subtle, gentlemen and type A ladies. And we're gonna feel, you should be able to feel that pelvis kind of slightly rock forward. Did I say it's gonna be some seismic shift like the earthquake in the 80s in like San Francisco? No, I said it's gonna be subtle. Does everybody understand that, recognize that, get that, somewhat feel it? If you do, raise your hand. Okay, cool. Is anybody totally lost? Raise your hand. Okay, we'll talk independently. What I can tell you is if you don't feel it at all, one, you're an analytical type, and it's interesting because the two guys that don't feel it are analytical types, shocker. And the other thing is because your hip flexor could be really tight. And I'm not trying to embarrass you guys because I used to be the same way. So I can identify it in you because that's me, but I've done a lot of work, and that's why, you know, I'm past it now. I can grow past it. Does that make sense? So you're gonna engage that pelvic floor. Now the whole time, like I'm engaging my abdominals right now, fully, and the pelvic floor, and I'm having a conversation with you. But I'm doing it subtly. So I'm probably doing it like maybe 20%. So it takes a lot of training, and it takes a lot of time to do that, to be able to talk and really breathe into the back of this, what they call quadratus lumborum. Basically your lower back, it takes time to expand the breath and get the breath going back there versus the conventional belly breathing. Because if you belly breathe, do you think you're gonna be able to maintain the integration of that core? No, there's no way. There's no way you're gonna be able to do it. So go ahead, and for us, go ahead and slide your scapula down, okay? You're getting a lot of length in the neck. Now go ahead and slightly bring in that pelvic floor. And now what you're gonna do, pardon me, do you mind if I touch your abs right here? So you're gonna come in like that. So you're gonna feel this, you're gonna get a wrap, right? Like everybody's gonna feel a wrap coming in. So as you come up right there, right, holding that pelvic floor, you're gonna feel like, kind of like if you were to put on body armor, or if you were to put on, what's something comparable? Like ladies, if you were to put on, what do you call those things that you, if you tie them on? No, what are the old things? Oh, is it a girdle? See, yeah, a corset. There we go. See, I was thinking of Maverick with Mel Gibson, the movie Maverick and James Garner, when Jodie Foster puts on the corset and they tie it down and it like sucks the air out of them. That's what you're gonna feel. You're gonna feel the corset of your ribs, this top rib, below your chest or pecs. You're gonna feel that corset come in. It's a very subtle thing. So as you lay, everybody take a deep breath in, drop the scapula, and now drop those ribs in and that corset in like you're doing a crunch, subtly, gentlemen, and now pull up on that pelvic floor. So does everybody feel a little more engagement than they normally do? Because what's happening is when you're trying to do a sit-up, first of all, conventional sit-ups are a joke. They're a joke because they hurt your lower back. How many Marines I got in here? How many people had lower back pain doing Marine Corps sit-ups? Everybody in here, right? We could do a yarch or a Semper Fi just based on that, right? We totally could. So yeah, so you want to bring those ribs in, you want to pull up on that pelvic floor, and you want to integrate those scapulas. When you integrate the scapula with that corset of your ribs, letting all the air out and letting all the air go to the back of your lumbars, and pulling up on that pelvic floor, it all should kind of come together. Does anybody on any level get what I'm saying? I'm not saying you've perfected it by any means. This is just an introduction. Because you're going to have to practice this. And there's YouTube videos and all sorts of stuff that we can engage you on subjects similar to this. If they don't talk about all the elements that I just talked about, they don't know what they're talking about. Okay? So from now on, when you do sit-ups, don't you think better than doing sit-ups, it would make more sense to do a crunch? So like when you do a crunch, and I wasn't going to talk about this, but God's telling me to do it, and it kind of goes with our subject, so I'm going to. You interlace your hands, and when you're coming down, when you come up, the integration of this core should come first, and then your head should be the last thing. So you're not forcing your head is following the activation of that core. Now, if your hip flexors are tight, go ahead, that'd be great. So if your hip flexors are tight, then you're going to want to set the intention, right there, you're going to want to set the intention of relaxing here. So like she tips down, pardon me, Justin, come here, so I don't feel paranoid about touching your wife's hip flexors. Come on up here, bro. So you're going to go right here. Oopsies. So go ahead and slide right here. Slide down here. Okay. So you're going to activate right here, and you're going to come right there. Now, so she should feel, and I want you to feel this too on this side, Justin. Watch. She should feel this being relaxed. So when you lift here, this should be relaxed. So you shouldn't be engaging those at all. So a good way of doing it, slide out of the way 1 second. So a good way of doing it is to kind of go a count of 3. So you take a deep breath in, and now start blowing it all out. Activate these. Okay, that was really fast. Let's try it one more time. So engage your scapulas. Slide the scapulas down. Okay, so you're going to go on my cue this time.
Okay.
Go back down there.
Really bad.
So it's okay. It's all right. So right here.
Okay.
Now slide your scapulas down first. Lengthen the neck. We're going to go step by step, okay? Now, bring this corset in right here, all right? Everybody see that when that came in? And now lift up right here, okay? So 1, blow some air out. Okay, so now come up. You're going to do 3 bursts of air. So like this, Amanda. So
Okay.
each time it's getting tighter and more defined as you come up. There you go.
Cool.
Perfect. Back down.
Wow, I could feel how that would
Isn't that awesome?
do 5 of those
Yeah.
instead of like
So she could
25
said she could do 5. You know how
regular.
Dr. Williams does? Years of doing this? Maybe 12. What happens is when you do those 3 bursts out, you'll be gassed. Everybody else is doing, they're doing crunches and what? Their abs or their lower back? Everybody else is gassed, right? You're gassed. Everybody else is doing crunches in their lower back. See it all the time. All the time. What's Dr. Williams doing? I'm chilling right here. Some guy's judging me. I don't care. I'm going to feel great after that. Right? I mean, seriously. Like, you got to get over that if you're a gym person. But that's what I mean about really educating yourself, coming to these classes and getting knowledgeable. How many people learned something just out of this so far? That's what I mean, guys. Like, that's like protecting your lower back. The most important thing is the subluxation, but after that's locked on from a neurological standpoint, then we got to start getting this going. You get that? Okay, cool. So come on up for a second. And what was the neck traction and the length? Just getting space and length out of your neck. You guys can sit back down now. So, just to not recap too much, but something I kind of forgot to mention, do you think any of this workout training matters if you're subluxated?
No.
No, it doesn't matter. Because here's the thing, a lot of people think that health is related to what? How you feel, how you look, right? So if you have 6-pack abs and you do P90X every day, even though you're going into your lower back and destroying yourself, right? A lot of people think that that is health, don't they? I mean, how many people think that? But what we know in this office is true health is related to brain and spinal cord communication. And when that's happening, your hip flexor can engage, but the same nerves that go to your hip flexor, they're going to your adrenal glands, they're going to your stomach, they're going to your liver, and that's what I'm looking for. I'm looking for that whole body activation from your brain, your spinal cord, your nerves, so you become the best you that you can be. And then the workout, notice some of you, you've been here for 3 years. I've never talked about this. Some of you have been practice members since we've been in California. Have I ever talked about nervous system-based workouts or anything even tied to that? No. The reason why I haven't is because you've got to totally be locked onto the principle. Because I don't want you getting led astray and thinking that if you work out, that's going to allow you to live 80 to 120 years of quality life. It'll make you look good. It's great as a de-stressor, but how many people know people that work out every day and they're and they have TMJ and they have all sorts of issues and forehead and they're a person you don't want to be around at lunchtime because you can't relax around them. So that's why releasing the subluxation and checking the neurology are the most important thing. And that's why Amanda is so effective at engaging certain areas of her body. And you get more aware and effective at doing that the more you go in. Health from within. So as we release some of the emotions, we become more self-aware, right? And when you're self-aware, you don't just become more self-aware from an emotional, spiritual perspective, you also become more self-aware from a physical perspective. You get that? Because how you do one thing in your life is how you do all things. If I'm very, very focused and I'm like, oh, the chair has to be this way, and you guys know I'm that way, right? Emptying garbage cans, everything's, tie's got to be that way, right? Then how do you think I am at home? The same way, right? My wife got mad at me last night because I was like little Cordie, she gave him a kale chip right on the carpet. Right before we got him into his what do you call them, high chairs. I'm like, that kale chip's going to go everywhere. Little Cordie, num nums. And he goes like that, and it's like kale chip snow, right? And I'm used to it, I'm used to it. But still, if I can prevent it, I like preventing this stuff, It is what it is. So at any rate, so we got arm, go ahead.
So in regards to the core activation and all those steps, is that only when we're doing the core work, or is that also when we're doing
Great question. I got a little off subject, and I appreciate you saying that, which I was going to integrate it in a second anyways, but we'll touch on that right now. So if I have my arms internal, is that going to help me integrate my core? No. But neutral or external will, correct? So if I'm doing a bicep curl, is it possible to do a bicep curl and activate my core at the same time? Would I get a better result if my scapulas are down or up? Down. You get that? So I'm integrating my serratus, and that's another reason why you might not only be able to do 5 crunches till the end, because you've been activating your core your entire workout. You get that? And if you're doing something that's really fast, like Orange Theory, like I do and stuff, you might not be able to integrate the core for every movement, but a lot of movements you could, right? On standing dumbbells you could. On standing chest press. So if I'm doing chest press, well, let me rephrase it. If I want to work my chest, and I'm going to show you an example workout in a second, what's the best movement for chest to do? Dumbbells. Dumbbell flies. Chest flies, dumbbell flies, whatever you want to call it, on an incline, a decline, or a flat bench. Why is that? Because I can integrate my core and I'm in neutral. So I maybe 1% of the time do anything internal in any of my workouts. I just don't do it. That's why I got a perfect curve. Besides the fact that I regularly get adjusted 2-3 times a week, I'm doing my traction, I'm doing everything I tell you guys to do. So, and I'm not saying that for any ego trip or anything, just to give you perspective of what it'll do, right? It's like amazing. And I used to have chronic lower back pain, all sorts of stuff when I was bodybuilding in my 20s. Chronic stuff, all the time. All the time. I thought I had a ruptured disc. It was an inactivation of all my nerves going to my muscles and my organs. I was subluxated. So that's what I mean. So if we're doing flies or we're doing dumbbells, right? This is going to be neutral. Dumbbells are going to be external, and we can integrate that core as we're doing those movement patterns. You get that? Would upright rows, is that a good exercise to do? No. Upright rows where you take the bar and you go like that, unless you want to have to get, like a coat hanger or something to wipe your tail, that's not real good because it's going to make you more internal and bring your head forward to your shoulders, guys. Terrible. Terrible. So what we want to do is really think about that. Look at that. Shoulders. Does anybody like traps that are big up to their ears and look like they're wearing earrings? You look like a weird monkey. What does that do to your forward head posture? Decrease it or increase it? Increase. So it's a big misnomer that doing all these shoulder movements is going to, the PTs will say it all day. I totally disagree with it from my work in the National Football League. Totally disagree with it. What you can do is some functional neurological stretching for your shoulders, right? We can work on getting this curve back, and what's that going to do? It's going to create less micro trauma in your shoulders, and your shoulders are going to be in a better position. Your shoulder's inability to do certain movement patterns is not a product of a lack of strength. It's actually a product of real flexibility and nerve stimulation. Everybody get that? So yeah, if the nerve going to a muscle can't get activated, then it doesn't matter how you strengthen that muscle. Give you an example. If I'm like this and my head's forward of my shoulders, does it matter, and I'm exaggerating, but this is the truth, does it matter how many bench presses I do? Is my chest going to get bigger? Why? Is this open or closed? Yeah, so this has got to lengthen and shorten, right, for us to get stronger in that area to get activated. So, did I answer your question?
Yes, and then it's also kind of protection too, right? Because I've had ribs pop out of place from doing some exercises had I kept my scapulas all down.
Yeah, but see, there again, what I want to really stress to you guys is you guys are thinking some of you are thinking that you can rigidly control that. You get that? So these are awarenesses to have, not to further hurt yourself, but these are not things where you're like, okay, I'm going to start doing this now and controlling this movement pattern, and then I'm going to get this result related to my health, and my ribs won't pop out. Because if you have forward head, I want you to really, really hit this for a second, or get this. If I have forward head and I try to control my scapulas being back, is it the scapulas that are causing the forward head, or the forward head that's causing the scapulas? Yeah, it's the forward head that's causing the scapulas. So as I retrain this, it's naturally going to be easier for those scapulas to glide. So you see how the subluxation and the neurology kind of ties in? Yeah, so we got to get the curve back, get that nervous system restored, and then these can start to rotate, and we can set the intention to have them go down and back. But we still may get a popped out rib, but with a functioning nervous system, it's going to be a lot less likely because the curve's restored. So I just wanted to reframe that part for a second. Is that it?
Yeah.
Okay, cool. So, third thing. Listen to your body, rest, stretching in between exercises. So I'm going to go over a couple of different nervous system-based workouts in a second. But first, I want you, when we talk about awareness and the top 3 things that you need to do to have a nervous system-centered workout, you know, rest is a big thing, guys. Some of you guys work out like I used to when I was bodybuilding, and you work out like 5 or 6 or 7 days a week. Some of you bike like 24 miles a week, and it's insane. Right? It literally is insane. And then you come in here, Doc, I don't know why this is going on. I got this problem, and I'm chewing on my left cheekbone and my gums and my sleep and all this. It's because you're trying to do something physical to run from your emotions and what you have going on in your life. My weekend warriors are the worst. They're the people that come in here. They're the people, that's why we don't do many marathons or triathlete type events, because usually those people wrote the book on health. Meanwhile, it's somebody that has severe low back pain, is emaciated, and has a really poor diet most of the time, right? They've got lean muscle tissue, but they've also got TMJ, all these major problems, and they're usually like this because they're so used to running and biking and lifting their stress away versus getting to the cause. You get that? So that's why it's so important. Rest is big. When you're resting, you actually build muscle. How many people knew that? So I always recommend some type of a split. There's exceptions to that rule. If you know your body, I'm going to work out again tomorrow, but then I'm not working out Wednesday. I'll probably work out again Thursday or Friday, and then I'll skip 2 days. I know my body. I feel my body, right? So it's based on what my body needs. And I don't, the core, it's pain is weakness leaving the body, right? When you're outside of the Marine Corps, you don't really want to adhere to that idea, that ideology, okay? It doesn't benefit you. And it won't yield you the results that you want competitively if you're in competitive sports or if you're a weekend warrior. It will not yield those results, okay? So I'd really, really, really encourage you, start resting, start looking at how much rest am I getting? Because when we were in the Marine Corps, we ran about, some days we would do 9-mile runs, some day we would do 7-mile runs, and then we would have a 3-mile run. So it could be anywhere from 15 to 20 miles a week. It was different at different units. Okay, sometimes we get a really easy week and it was like 3, 3, and 3. But they would always at least do, most of the units I was with would do a Monday, Wednesday, Friday if we ran. We would get a day in between. Jason and Jonah, can you guys attest to that? And Trey? Yeah, so it's probably still like that, right? Why is that? Because your body needs time to recuperate. Your body needs time to recuperate. So start doing that with your workouts and really looking at that and listening to your body. When you're in pain, that's not the time to push through it. That's when you're a heartbeat away from injury. You're a heartbeat away from injury. And that's when the functional neurological stretching comes in. Listen to your body. If you feel something and it intuitively feels foreign to you, you need to listen to that. Your body's trying to warn you. You get that? And I don't think there's enough conversation about that out in our culture and stuff. Stretching in between exercises. So the functional neurological stretching, we're going to integrate that. You can watch the video from last time. Some of you, I might not have thought last month that you were ready for that, and now I do think you're ready for that because I don't want you to think that's like the silver bullet. Sometimes when you give people stuff, they're like, oh my God, this is all I have to do, right? I'll just do this, right? And I don't want you guys to get mixed up and misled by that. So stretching in between exercises. So what Dr. Cordie does, when I do a workout, if it's an upper body workout, I might need you one more time. That's why you're staying up here. Sorry. When I do an upper body workout, I pick an exercise, and then I have a stretch, and then most of the time I'll do another exercise, and then I'll do another stretch. Okay? So there's a latissimus dorsi stretch. So you guys don't even know what that means. It's a muscle that goes from here to here. So what did I name it on the website? Twisty bear, right? It's fun. You know me, I got to get weird with it, right? It's like cutie bear. Everything's got a bear on the end. So at any rate, so dumbbell flies keeps, right, our chest and our arms. If we're neutral or external, what way's the curve going? Forward or back? Everybody get that? If I'm neutral or external, gravity and my shoulders, you get that if your shoulders are internal, there's only one place for your head to go? Is anybody not tracking on that ideology? Okay, because it's not a theory, but it is a way of thinking, right? So when we're neutral or we're external, there's only one way for the curve to go, which is back. When we're internal, there's only one way for the curve to go, okay? So really think about what is my shoulder. If you don't know, just arrange with the dumbbell or the movement you're about to do, right? Because what would tricep pull downs do? Internal, neutral, or external? Tricep push down, sorry. Neutral. No, that's internal. Because where's your finishing thing and where are they rotated? But that is confusing, Caroline, so I'm glad we're having this conversation. Because that's the thing, if you're doing this. Now, what about if I do preacher curls like this, which I think preacher curl is the most horrible thing in the world. Those of you that do bicep curls, they need to be thrown into a dumpster somewhere. Because what's happening to your core activation and your scapula activation? Preacher curl, where you do curls, all my guys, right? The only two things we know how to do in the gym is chest and biceps, right? So you're like this, and you're way out here. What's happening to your lower back and your scapula? It's not supported. You're not going to build muscle that way. You will take 10 times longer to build muscle that way versus my way. Guarantee, and that's not ego, it's just fact. Okay? So, well, chin-ups and pull-ups, let's talk about that. So you want to get your back stronger, right? If you're building muscle, anything with low repetitions, right? And Arnold wrote forever about this. He would do movements just for the gross movement, right? Because if you do 8 reps of anything, you're going to get stronger. But you're also, the part that wasn't in Arnold's book is talking about injuries, right? That's the part that's not in there. This is external pull-ups, okay? But it's also your body weight. A lot of times I find, and the Marines in here could attest to this, you initially, if you're not used to doing pull-ups, you're not just going to get on the pull-up bar and do perfect form and be amazing at it, right? So you're probably going to strain something and really hurt yourself and not focus and isolate the muscles you're trying to focus and isolate on. I would recommend a low row or even some type of back machine. And I would recommend a neutral position where you're doing a chin-up on a machine. You have your core engaged, you drop your back at like a 45-degree angle. Your knees are supported, some of those universal machines, if you know what I'm talking about. And then you're just pulling down right here, engaging your core the entire time. You get that? Does everybody know what a universal machine is? But see how I'm going this way? With the bar, it's a bar that is a cable-based system that pulls weights. And when you pull back, the weights go up. But you're seated. You're seated in like kind of like a position or a bench where your feet would be up. And then what I recommend that people do is bring their bring their body, their torso back to about a 45-degree angle, and then they're just going like this. You get that? So you're just pulling down. And that's very neutral, and that's going to achieve the same thing related to your back. Same thing related to your back. We do a lot of movements in the gym because we saw somebody else do them, but we actually don't know what we're doing. Can anybody attest to that actively goes to the gym? You're doing something because Uncle Tommy told you, or Johnny had really big biceps and a chest, and you like that? Like, seriously, guys, let's be real here. You're doing stuff, and you don't even understand the biomechanics of what you're doing. Do I say that to be mean, arrogant, ugly? No. I was you once. I just spent like 300 grand, and that's why I understand all this stuff, and worked on NFL athletes. Like, seriously. So this conversation is really big, and understanding the biomechanics is so pivotal to you not hurting yourself and really doing that nervous system-based workout. So this is only like this much. I'm trying to give you some fundamentals because this is a deep conversation. Anybody get that? Yeah. Did you have a real quick question? Can we go at the end?
No, I'm good.
I'll go at the end. I promised you last time. If you guys bum rush me at the end, I got to entertain Gopal's questions. She's been really good. Somebody, like 2 people came before him, and I wasn't able to address his questions last month. So, dumbbell flies, okay? So after we do those dumbbell flies, then in between, we're going to do a pec stretch. What does a pec stretch look like? Jordan, can you get me from here? Okay. The pec stretch is going to look like where I bring one leg out, okay? One leg would be out. I'm pressing into the wall, and this is on the website, and now I'm going forward. Pardon me, can you scoot back just a little bit, Janet? Sorry.
Sure.
Sorry, I didn't plan this. I'm going with it. And Nate told me to do it. So I'm dropping my scapula here. I'm pressing into the wall, okay? The entire time I'm pressing my hand into the wall, and now I'm rotating this way. I'm rotating. So my left leg is up, my right leg is back, and I'm rotating that way, and I'm rotating in, out, and in. Does anybody see my arm here and my body way far forward and my shoulder joints back here? Destroy your shoulder capsule. And you'll see the biggest guy at the gym, he's got the smallest t-shirt or a tank top on. I used to be that guy. And he'll be just destroying his shoulder joint. And then he'll be the guy grunting when he goes and does the internal bench press. I was that guy, so I know. You can drop your arm neutral, come here, and then you're going to feel and see the pec fibers stretching here. You're pressing the wall, you're going back and forth. I will give you that stretch online. I'll give everybody access from a password standpoint online. But what I'm going to ask out of integrity is, unless I assign you a specific stretch, you don't go like, all out and start, and I'm going to do it after the cameras go off. So the people eating popcorn at home don't get it, right? For a bunch of reasons. One, because they didn't come to the class. So, you don't come to the class, you don't get the prizes, right? People that are here get it. So at any rate, so you do those dumbbell curls, and then you do that stretch. Now, what would be another good stretch we could do? Because if we're lengthening these, is it fair to say that the muscles in the back need to be able to shorten? If I lengthen one muscle, shouldn't the balancing muscle group shorten? So isn't its ability to shorten directly related to its ability to be, from a nervous system standpoint, stimulated? Yes or yes? Yes. So then we got to start working on those back muscles too, right? Which another stretch you could do, and this is not on the website, okay, this is not on the website, is if you get in a seated position, and I didn't plan this either, and Nate told me to do it, so I listened. You're going to press back like this, and you're going to bring your arm in. So I'm resisting, I'm pressing back with my arm, and I've got a 50-50% resistance, right? 50-50 resistance, what do I mean by that? Who was here for the class last month? The moment of truth. Like 4 people, right? So, hey, so maybe we should have done a Monday night. I don't know. So at any rate, if you stretch the bicep, right, we resist up like this. One of the things we talked about last month in the video is there's got to be a 50-50 synergy between your ability to contract the bicep muscle and your ability to bring it through a full range of motion. So the movement stops or the stretch stops when the ability to contract stops. Who remembers that from last month? Praise God. Yeah, and that's in the video. So this conversation, you'll better understand it by watching the video from last month. Yeah, so resist up, come all the way down with resistance. When your ability to resist yourself stops, meaning when you feel that point where, man, my contraction is getting a little less than it was 2 seconds ago, then that movement pattern is done. If you keep going, you will injure yourself. Everything else is a farce, a gimmick, makes the muscle hot, And then you go in the mirror and you're like, oh, nothing really changed. And actually, I look like a weird gargoyle still. Yeah, that's not real stretching, okay? So we're going to resist out with our arm to stretch the back of what we call our rhomboids, okay? Or some of those smaller intrinsic shoulder muscles back there, okay? You're going to resist back, and I'm going to come in, and right here, that's about where Dr. Williams stops for now. So I'm going to have to go to the inside, pull in, and against my own resistance, take myself out. Pull back in, take myself out. So there's a 50-50 synergy. So believe it or not, I'm resisting myself, but allowing myself to move, because that would look weird if I just sat here like this, fighting myself. That would look really weird. You guys might get a good laugh at it and out of it, and apparently you did, right? But I wouldn't get much done in the way of changing my body, right? Yes.
So you're calling this workout, you're calling it stretches, and you've given me several of these, and I've been online, and I'm doing them. And what is it? Is this a workout?
Absolutely. So the first thing, one of the things we just talked about, and I might have inaccurately characterized it or talked about it, is we talked about arm rotation, right? Different arm rotations to have. We talked about core activation. And then we talked about rest and stretching in between exercises. So this is an example of a workout that's going to encompass all of that, a workout example. So maybe I didn't give enough context around that, okay? But we're doing a workout, then we're doing a stretch, we're doing another workout. Caden just kind of flipped up there. I think it's on the, should be on the handout. So dumbbell flies, pec stretch. Yeah, we had a miscommunication there. So it should be dumbbell flies, pec stretch, dumbbell flies again, and then the twisty bears. So you need to insert a dumbbell flies right there, okay? Everybody knows what dumbbell flies are, right? Correct? Anybody not know what dumbbell flies are? You don't know what dumbbell flies are? Take dumbbells. Cool, these are good questions. So dumbbell flies are when you take two dumbbells, okay? Go ahead and lay down, Amanda. So a dumbbell fly, I just assumed, you know what assumptions do, right? So you're going to take a dumbbell, and what she's going to do is, first of all, she's going to engage, drop the scapula down, integrate the corset, right? Pull up on those lower abs and feel that wrap coming together. She's going to breathe out the back of her lower back while she's doing this. While that's going on, since a movement for any chest movement starts from the back, she has dumbbells, imaginary dumbbells, in her hands, and she's coming back and forth, okay? And I would recommend, you know, if your idea is to get toned, I would recommend doing, 10, 12 reps, right? Sometimes 14. And all it would take for something like this is about 3 sets. It would just take 3 sets. And then what you're going to do after you do that dumbbell fly is you're going to move into a pec stretch.
So you do all 3 sets and then do the stretch.
Well, no, you're going to do 1 set. You would do 1 set stretch, 1 set stretch, 1 set stretch. But this isn't a fixed thing. This is an idea and a concept. Why do I say that? Because the idea and the concept is, come on up. The idea and the concept is that you're going to go off of what you innately feel. You get that? So maybe that's where the confusion was. I apologize for that. So yeah, so you're going to do a movement pattern. After you do that movement pattern, you're going to do a stretch. Then you're going to do another movement pattern, i.e. exercise. Anybody still confused? Great question, because if you had it, I know a lot of people had it. Any other questions around that? Go ahead.
Can your feet be on the ground, or do you have to have your feet level or your legs at a 45-degree angle?
Great question. I would recommend, it kind of depends on where your lower back is. Great question, Justin. Anytime, I used to put my feet up when I did dumbbell flies. Now and this is going to be bad for some of you that are just learning this, but now I do it based on how well I feel like my core is integrated. If my core is integrated really well when my feet are on the floor, right? Because go ahead and lay back down. Sorry, Amanda, she's getting a lot of work tonight. Earning that massage, right?
I know, right?
Slide back here. Slide back here. Now, so if Amanda has her legs down, right? Now go ahead and integrate your abs. Okay. So when she comes up, go ahead and do a sit-up. So when she comes up, see how her pelvis is kind of moving like this? It's very subtle. So if she had that problem, you can go ahead and drop back down. If she had that problem when she does flies now, I don't necessarily want her to be in her lower back and tipping backwards. I don't want her going like this.
Because when I go like this, then my lower back.
When she's doing dumbbells, I don't want her to be like this. So what I'm going to have her do is bring her legs up so she can integrate her core. Go ahead and go the other way. So she can integrate her core, come down, and kind of get somewhere in the middle. So that's the nuance you got to find. Yeah, so see, you want to be slightly tipped there so you can engage those lower abs. You see that? Because if you're curled up, you're actually going into your lower back. You're not engaging your abs. But your hip flexors are really tight, so that's why it's preventing you from doing that. So she should have a little bit of, sorry to interrupt you, she should have a little bit of a tip right there. Does everybody see that? The difference between that, go ahead and go back really far. That's exaggerated. And this.
I've been taught.
Yeah.
Squeeze all the way down so there's no space whatsoever.
Yeah, they're like shot. Whoever taught you that. Yeah, sorry. Sorry, love them. Whoever said that. Yeah, totally not true. My brother-in-law would be so proud of me because he says shot like every other word. He's from New York. So what you want to do is you want to tilt this down and integrate your abs. Does everybody see how if you go here, and I didn't mean to be ugly by saying that person's shot, but it hurts people's lower backs. And that, you know, I don't like that, right? So if we go like that, do you see how now it's all in the lower back? When you flex like that, there's no room for you to be here. And I know that's hard to see, just trust me on that. And one day you'll feel the difference as you become more aware in doing this. You get that? Anybody totally lost? Or as Killian would say, shot right now. So, dumbbells, abs integrated, and you're gonna come up like this. Anybody getting anything out of this? Anybody? If you're not, say so. Come on up, see Daisy. Okay, so dumbbell flies, pec stretch, dumbbell flies, and I'm not even gonna explain the lat stretch. I'll let you, I'll encourage you to go check out that one as well. That's one of the most difficult ones on there. I spend a lot of time on it, on the video, covering that, because here's my goal. Do you think that if my shoulder's like this and my hips jam this way, that I'm going to be able to integrate my core? No. That's what's subtly happening to most everybody in this room. And you're trying to integrate your core and you're trying to do a movement pattern to stretch your chest, and your head's like this and your arms like that. And I'm exaggerating. Your curve's a lot better since you started coming here. Your neurology's working correctly. But now it's time to integrate something else, because otherwise your workouts, you see how all this that I'm kind of talking about, if you're doing a workout that isn't kind of in alignment with this, you could make some really rough decisions to negatively not propel you forward with your progress here, but really limit you. You see that? And so that's why some of these even simple, if you integrate that much of it, guys, it'll have a profound impact on you. Profound impact. And then you can share that with other people. That's the blessing there, okay? So this stretch is called twisty bear because you actually twist and there's a line of fascia and muscles that go from this shoulder capsule all the way to the top of the hip. And it's so amazing that literally you will feel the hip drop and you'll feel your shoulder go back if it's done correctly. But it's very complicated, okay? But the only reason I'm recommending it because when you figure out how to do it, I mean, it's so awesome to do in between any workout. I mean, when I'm in the gym, I typically do that one. It basically involves, you're kind of in a V shape. You're sitting up. You've got a towel, and you're twisting through a movement. And it's stretching this whole line of musculature right here. It is unbelievable on a nervous system that is centered, balanced, and neurologically working well, okay? So really, really, really want to encourage you, look at that one. Don't ask me what module it is. It's the only one that says twisty bear on it. Okay, so you can look at that one. So twisty bear, pec stretch, okay, in between some type of dumbbell workout. Does that mean that we can only do pec stretches and twisty bear between the dumbbell flies? No. This is just an example of what one exercise that I would do in the gym would be, okay? You could do standing tricep, dumbbell tricep extensions. Because if I'm doing standing dumbbell tricep extensions and I'm like this, what direction is that? Is that neutral? Is it external or internal? Well, a little bit of both actually, okay? A little bit of both. So you could go like this and you could stand when I go here, I'm internal, but do you see how the shoulders stay kind of neutral basically the entire time? It's kind of like the keyboard. If we're down here, you see how this is neutral, the way my humerus bone, my arm bone hangs, but then when I go below the elbow, it turns internal. So that's kind of like middle of the road, not perfect. What would be a more perfect one? Sitting on the floor doing dumbbell extensions. Okay? But the standing dumbbell one would kind of be, that's like a 50% good exercise, if you want to call it that. 100% would be the dumbbell extensions.
That's a question.
Yeah, go ahead.
So then you're saying as best as we can avoid anything that puts our arms in internal rotation.
Yes, and be aware of it.
What are they called? The hammerheads or something, like with the bar.
Skull crushers. Yeah, a real scholar created that name, right? No, we used to call them that in the Marine Corps too. Skull crushers, We used to call them that too. But no, that would, yes, it would be internal.
So we're just trying to avoid those.
We're trying to avoid internal. It took me a second there. See, I got to think about it. Yeah, that would be internal. So it would be better to be in a neutral position and do those tricep extensions this way with the dumbbells. And even if you used, sometimes what I'll do is take a bar on a universal machine, okay, and I'll do tricep pull downs, and I'll have the bar attached to the top of the universal machine, where I've got tension on it from the cables, and I'm coming down like this. Is anybody lost that's never been in the gym? I'm sorry, I'm doing the best I can to explain it to you. But basically, you attach, there's two places on a universal machine that has cables and weights in the middle, and there's a place to attach and do movements from the floor, and a place to attach and do movements from the top of the machine. And what you're gonna do is pull it down, integrate that core, scapula's back, and then you're coming down like this into extension here. You get that? You're not coming all the way up. You're keeping the core integrated, you're only coming to 90 degrees. Okay? So that would be another good one too. Okay? Just wanted to give you some more stuff for the upper body. Now, lower body. Before I go into lower body real quick, how many people think that all the different machines in the gym were designed by a biomechanical specialist, a doctor, and somebody just well-versed and travels around the world? Or how many people think that it was probably designed by somebody that just wanted to make money? I'm going to take door number 2, Alex, for $10,000. Yeah, somebody that wanted to make a bunch of money. So many of you go in there, and then you see Joe with the gray tan, because he just got done out of the tanning bed, putting carcinogens into his body, and the skin-tight T-shirt, and you say, oh my goodness, I'm going to do what Joe's doing because I want my body to look like that, right? So you get on this piece of equipment like leg extensions, guys, hammer strength leg extensions, leg curls. All those machines are toxic, man, toxic. I cannot tell you enough how toxic they are. Okay, the seated hamstring curl, I don't know why I had that block there, I just couldn't think of the word. The seated hamstring curls or the seated quad extensions are terrible because it's not doing the full movement that the muscle needs to be doing to even perform that movement pattern. And you're sitting, and if you think about your pelvis, generally you're not on your sit bones, you're laying in your lower back. You get that? So just kind of chew on that. Chew on that a little bit. There's other ways to accomplish that. Standing hack squats, right? Front squats with dumbbells, right? Most of the time when people do squats anyways, they're trying to get their glutes tight. I mean, let's be real here, right? Do resistant functional neurological stretches on your hamstrings and then go do squats to get your buns tight, right? Or get your hamstrings and buns tight at the same time and do hamstring bridges. Oh, that's like sissy stuff, Doc. I don't do that, man. I go straight to the hamstring curls by hammer strength. Okay, if you're doing hamstring bridges the correct way and you're integrating the core like I'm teaching you tonight, your hamstrings will be burning. How many people know what I'm talking about? The bridges, why don't you go ahead and lay down for me, please, ma'am. Okay, so go ahead and put your arms down like this. We're going to activate our core, so we're going to slide the scapula down, okay? So we're integrating the scapula. We're going to integrate this core set a little bit. A lot of length in the neck, so that's what we were talking about at the beginning, right? And then we're going to come into these lower abs. Now, so all this has to be wrapped. Now, while all that's wrapped, pulling up on that pelvic floor, I want you to press through the heels and lift from the buns all the way up. Keep lifting, keep lifting, keep lifting. Now back down. Now back up. Yeah, so go ahead and go back down. So she did too, right? So now is that different than totally different?
I do like 100 of those and not
Of course you do, because you're going into your lower back.
Like, squeeze everything and it's so different.
Because she's actually, what did you feel more of? Did you feel more or less activation in your hamstrings?
More?
Well, don't tell me if it's not true.
Well, no, I don't know.
I mean, don't guess. Well, I don't know what I'm supposed to say here.
Well,
Say
no,
what's true.
I'm feeling more activated.
Are you sure about that, or are you on candid camera and you're just
But
posing
then
now?
I usually do when I do those. Because I
Okay,
do those,
why
but
do you-
I've never done them like that.
Okay,
And
what?
I've never done them in heels either.
Well, that's definitely true, right? But besides the heels, why do you think that's the case, that you felt it more, in your humble opinion? You can do it again because you're more kinesthetic anyways. So why don't you do it again on your own? Practice the fundamentals. Okay, so your core set, got the scapula down, you're engaging that pelvic floor, and now pump it, go back and forth. So why do you think that you're feeling it more?
I guess it's
Go back down.
Controlled.
Well, it's definitely
the position
controlled.
I'm supposed to be in.
Totally,
instead of
'cause
just
what-
flinging myself
Yeah,
back.
because if you're flinging yourself around, the pelvis is not actually in the right place for the hamstring to get engaged. So your hamstring attaches to right around, if I'm not mistaken, right around to your ischial tuberosity, okay? Which is the lower part, it's the butt bones, the bones you sit on. So if I'm not integrating my pelvic floor or my core, and my pelvis is out like this, I'm not really going to totally engage or hip that hamstring. You get that? So in all likelihood, I'm going to be working the lower part of the hamstring or my calves. Anybody ever ran and never felt it in their hamstring? They just feel it in their calves? Yeah. It's because your hamstrings are tight and your hip flexor is not balanced, by the way. That's why you feel that, because your hamstring's not working. The larger muscle group is supposed to do the movement, not the smaller one. And soon you'll have hip flexor stuff and you'll have knee pain too, because you're overworking a muscle that's not supposed to do that movement. You get that? So when we have engagement and the core is integrated, you see how the rest of the body can kind of fall in line? Anybody totally lost, or as Killian Breen would say, shot? Okay, good. So hamstring bridges, right? So hamstring bridges, and then if we're doing hamstring bridges, what do you think is the muscle that is going to kind of balance the hamstring? It's right up here. So, yeah. So if the hamstring, for the hamstrings to shorten, the hip flexors have to lengthen. You get that? So I was in between sets this morning and everybody's looking at me, you know, breathing. Some people are doing the bowel movement thing that they're doing. And I'm just sitting there easy going, doing my stretches, burn my 600 calories and doing my stretches in between, right? Doing my stretches in between. Everybody's looking at me all weird and I'm like, whatever. So hip flexor stretch. Because if the hip flexor can lengthen, do you see how you would be able to get into that lower pelvic region deeper? Does everybody get that? And if you're in that lower pelvic region deeper, what's going to activate more when you do a hamstring bridge? Your hamstrings. So it's always, think about the body as a pulley system. When the biceps can lengthen, the triceps can shorten. Everybody still getting something out of this? Or you guys are glossing over, man? We're almost done, I promise. Okay, so lunges. Why don't you, without going down all the way, why don't you kind of stand sideways here? See, I'm cheating you because I'm in a shirt and tie and I don't want to do a one-legged lunge. I did like a bunch of them this morning. So you're going to slowly go down and do a one-legged lunge. Yep, and now all the way up. Press them back through. There you go. So that would be a one-legged lunge. Okay, if you want to do training, you can. You're just doing. She's awesome. So a lunge, one-legged, right? You're going to do one on one side, and then you would get into pigeon. Everybody's seen pigeon in yoga, right? Where the legs forward. Nobody's seen it? Can you get into pigeon? Sorry. So one leg goes forward. Yeah, why don't you do the right leg? We'll probably have you do both. Now, so the nuance that Dr. Williams is going to do is press your lower leg and calf area into the ground. Don't press it down with your hands, though. Well, yeah. Like press it into the bench. And now, is that really intense?
No, I can go more.
Okay, so go to your forearms. Press this down into the ground the entire time. Yeah. Where do you feel it? Right here. More intense. Different feeling than what you normally feel, right? You're pressing into the ground the entire time. Because Amanda, while you're doing that, describe to me what you're experiencing right now.
It almost feels like I'm actually doing a workout in my hip.
Okay.
But it's also,
And what do you normally feel? It's kind of like you're just like a slinky, right?
yeah, it's like
Okay.
I usually, like, I won't do it, but I
Okay.
usually just, like, collapse into it, and then
Yeah.
it's almost like a burning sensation.
Uh-huh. And that's because you're overstretching and doing damage to that area of your body.
This is still like a tight, like I feel it sensation, but it's
Yeah.
not like burning or hurting in the
Okay.
way it usually would.
Did everybody hear that? You hear that? So it didn't burn like it normally does. Muscles aren't supposed to burn, guys. They're not supposed to burn. Okay? They're not supposed to burn. Yeah, you can. Go ahead and switch to the other leg if you don't mind.
Yeah.
So they're not supposed to burn, folks. They're not supposed to. And when you get up from a stretch, you're actually supposed to feel lighter. So she's pressing into the ground, just to be clear, from her knee all the way to her heel. She's pressing that forward leg, the leg that's being worked. She's working right now the outer thigh of her left leg and the left glute. Everybody get that? That's what she's working right now. So eventually it's going to be a great stretch for you, Justin. Seriously. We got to wait a little bit of time, but you actually might be able to do it right now. But I wouldn't want to chance it, you know, as Joe McClayton used to say, my best friend, I don't want to risk it with the biscuit, right? But you could do the other leg, the other forward leg, okay? And we could get that other leg going, you know, eventually, because you're going to be compensating at that other hip right now, okay? So, so go ahead and stand up and move about the cabin for a second and tell me what you're experiencing.
Well,
What do you notice?
Loose, and
Okay.
I noticed actually the first time you gave me the stretch today,
Uh-huh.
I almost like, when I stood up, I almost like sprung up because it
Okay.
was like,
Yeah.
felt very like fluid and elastic.
Okay, so you felt fluid and elastic. When you do the, how shall I say it? Best way I can say it is carcinogenic stretching, regular stretching that we learn in grade school in the Marine Corps. Do you feel that way?
No, it almost feels like you have to like slowly move yourself out of it so that you don't snap.
Did everybody hear the difference in what she said? In her words now. So if I'm stretching something, should it be painful and I feel like a gargoyle and a weird animal? Probably not. I should probably be able to spring up and feel loose. You know the other comments we hear about functional neurological stretching? I feel lighter. I feel looser. I feel like I'm gliding. Sometimes people will feel euphoric. Sometimes if, like some of the physical stretches that are in the physical world of the whole system that Bob Cooley has, right? Some of those stretches will actually, they have personality types. And I've added certain things to certain stretches that I experienced working with athletes, right? So if we did hamstring bridges and then a hip flexor stretch, then if we do a lunge and we do pigeon and we go back through those movement patterns, doesn't it make sense that we're going to get more out of that workout? Because she just said she felt lighter and looser. So don't you think that her muscle's going to engage more now when she does that movement pattern? Absolutely. I'm not going to cover the cardio. I'm going to kind of close it down because we're getting everybody's like wanting to go to a peaceful place right now. Go ahead.
With the lunge, it's one. You're not doing one set. So like, you know, like
Yeah,
10 lunges.
you would do it.
One rep of
Just
a lunge.
one.
No. You would do multiple reps. I'm sorry I was unclear. I'm sorry if I was unclear, but I'm trying to get a concept. So the reason I didn't put numbers or amounts here is because some of you are, you're going to rigidly do whatever I say, and I'm trying to get you to think. Did anybody get that from what I'm doing here? So if you were frustrated I didn't give you numbers, because some of you, you'll do exactly that amount or you won't do that amount based on what I say. It's very mechanical, right? And I don't really want to create that. I want to get your brains thinking. So that's why I didn't write numbers down here, okay? But in theory, the way it would be is, like, let's say you did 7 reps of hamstring bridges. Then what I always recommend, some of you that are doing the functional neurological stretching, you would do 6 to 8 reps of the hip flexor stretch on each leg. Then you would go back to the hamstring bridges. Then you could do another set, then you could throw in a set of pigeon. And then you could do a set. What is a set? It's multiple reps. It's whatever you want it to be. Okay? And we can talk more about that extensively at the end. You can ask me a question around that if you need me to elaborate on that. And then lunges would be, I don't know, if you wanted to build muscle, 7 reps. If you want to tone, 10 to 12 to 14 reps, okay, on each leg. okay? Now, if that's your limit, then obviously go less. Obviously go less. Some of you, just from doing, the fascia is so tight in some areas, and it's going to be stimulated very quickly because of everything we've done with your nervous system. Some of you may only be able to do 3 reps of the actual exercises and then 4 reps of the stretch, because there is a resistance phase and a strength phase. And I talk about that in the functional neurological stretching videos online. How many people have done the videos, or I've recommended them? How many people have seen that there's a stretch part of it and a strength part of it? Yeah. If I stretch my bicep, on the way back up against resistance is the strength phase of that. And obviously, I'm going to be stronger as every rep of that stretch happens. You get that? Did I answer your question, Gigi? Yep. Okay. Can we pass around? I'm going to take questions now. I'm going to forego the cardio part. You know, generally we try to keep these, I promise, about 45 minutes, but between people walking in late and stuff happening and, you know, just different things happening, that's why it goes over sometimes. But every time we're trying to get them shorter. I apologize. Questions?
Okay, so you probably already answered this, but just like previously in my other training that I've done with other people, they've emphasized...
Is this good where we can hear Jordan? Okay, cool.
You know, they've emphasized, you know, getting a muscle from every possible angle. And then, so now you're telling us don't do anything internal. So...
Okay, I need
now,
elaboration on that.
Okay, so let's just say with the
what?
triceps, right? So you gave us the overhead triceps to do, and then, I don't know, let's just say one other tricep exercise, but you said don't do the hammerheads.
So here's what they were telling you, though. You know the undercurrent behind that? The undercurrent behind that is void of biomechanics. We want you to get this one individual muscle group strong, irregardless of what it does to the rest of your body. You get that? And I'm not trying to say anything bad.
That's why I'm asking.
Like, that's my matter-of-fact
Yeah.
thing. That's the only way I can articulate it, because I want you guys to see, like, I want you guys to be able to see that. Does it? Now, that makes sense if your goal is to just get strong, but what are you sacrificing in the process of doing that? You get that? And how strong are you really if you're doing that and the biomechanics are off? Does everybody know what biomechanics mean? The way your body naturally works, your body's like a machine, very similar to a car. So if I want a car to perform, it's got to be aerodynamic so everything fits and works together. Your body's the same way from a muscular endurance standpoint, a training standpoint, all that. Does that make sense?
Yeah, and I'm just asking because from my mind,
No,
I'm
it's
like,
a great question.
I will be out of balance if I don't hit the muscle from every single angle, but that's obviously not the case.
Well, it's just the opposite, because here's what their ideology is. And this is the way a lot of PTs are too. If the muscle is weak, right? If the muscle is weak, or if the muscle is too long, short, contracted, what they want to do is strengthen the opposing or balancing muscle group. Their idea is around strengthening. Notice the difference between the vernacular of strengthening versus activating. We think a muscle's out of balance, so let's strengthen it. Well, what if the nerve can't activate it? Does it matter how much you're strengthening it? How many guys like this doing more bench presses to get their chest bigger actually get their chest bigger? But we could have them do functional neurological stretching for like 5 minutes. We could do some simple moves that are going to be on the next 10 videos that I'm going to be making in the next 6 months. And we could do those, and they would look in the mirror, and literally they would see their shoulders are completely back, and it looks like they just went to some rich doctor in LA somewhere and got a facelift. Like, seriously. And they no longer look like a weird animal that can barely wipe its butt. Their head is over their shoulders are back. You get that? Did that make sense? Because, so, and I didn't mean that. I didn't mean to be too matter-of-fact. Sometimes when I'm passionate, I get intense or whatever. Well, okay, cool. So, because if your head's forward your shoulders, right? You get that, Justin? And I'm like this. Yeah, I can work my tricep. Oh, look at me. I got all the heads of the tricep. Yeah. But at what am I doing to the rest of my body? You get that? And there's the other thing I would say is, perfect example, just to elaborate on this concept. You saw how when Amanda couldn't integrate her core, how she was like, kind of like, hey, I flop around when I'm doing hamstring bridges. When she integrated her core, she talked about how much more that muscle activated. So take that ideology or that concept and pass that on to all the other muscle groups that you have in your body. That's literally what it's like and what we should be doing or not be doing. Does Did I answer your question?
Totally.
Any other questions? I'll take a couple of more and then I got to move on. Is everybody learning something? I know you guys are tired. Like I said, I'm working. I don't want this to discourage people from coming. I really work on it every month, but sometimes stuff just happens. So all I can do is apologize to you. Go ahead, Kristen.
Would you suggest doing, like, you're talking the body as a whole, would you suggest doing like the upper body one day or the lower body one day, or is it okay to kind of integrate them together?
Yeah. You know, different people have different philosophies on that. I can tell you when I wasn't doing Arch Theory, like my workouts used to take, my wife will tell you, my brother-in-law will make fun of me. We would go to visit and we would be stretching and working out for 2 or 3 hours. Like seriously, sometimes 4 hours. He's like, you guys started at 9 a.m. and he would make fun of me and get into some yoga pose. And my brother-in-law is like a real big roughneck, so it's funny seeing him in any yoga pose or position that's even close to that. But at any rate, you know, what I would recommend is you could do either or. It's really about what feels good to your body. I like mixing stuff up. I get bored when I'm doing too many different movement patterns. So I'll do, legs are naturally going to stimulate testosterone, guys. Doing legs will naturally stimulate more testosterone in your body. And legs are going to typically burn more calories because they're harder movements and faster movements to do. Okay? And so I would recommend doing a leg movement, doing a stretch, doing an upper body movement, doing a leg movement. But also you want it to be quick. So one of the things we didn't get to is, like if I'm trying to do interval training for cardio, then I'm moving from one movement into a stretch, into another movement, into another stretch. Like when I used to train on my own, I'll do a stretch. I'll be done in a 45 minutes an hour with a workout now versus the other way I used to train, 3 or 4 hours, right? But I'm going fast. I'm mulling through them, unless I want to spend more time in the gym that day. But it's a set, a stretch, a set. Sometimes I might do 2 exercises, like 2 movements. I might do triceps with dumbbells, right? Maybe I'll do lunges each leg, and then I'll do a stretch. So it's really whatever you want it to be, as long as you don't get bored. I would recommend doing any workout you do consistently for 2 to 3 weeks before you change it and rotate the days or the exercise movements. There's different theories about that, but I think it's 2 to 3 weeks before you change it. Whatever way you decide, and then change it up. You always want to keep your body guessing. Did I answer your question? Cool. Any other questions?
So when you're doing the row, is that not internal? Because when I was thinking about doing all the movements, I was like getting a little confused.
Yes, that is internal.
It is internal? Mm-hmm. But isn't rowing supposed to be a really good workout?
Rowing's great, but see, I don't worry about that because I'm in a different place. Mm-hmm. Might be something for you to think about.
Okay.
Might be something for you to think about. But it's only one movement pattern. Yes, you're doing it a lot, but if you get with everything you're doing here with your nervous system, as we get you more, I don't think I need it. I'm like that. You're freaking me out.
I was just throwing you
off. Like, do I need it? Can you hear me?
Like I needed to do it.
Oh, you felt like you needed to do it? You wanted to interview me?
Yeah.
All right, this is cute. Okay, cool. You got to leave this part in, Jordan. It'll make everybody laugh. What with everything that you're doing here with a nervous system center workout, doing your stretches on your own, doing the twisty bears, all that, some of the stuff you're going to learn today. And I only want you guys looking up the twisty bear, the hip flexor, and pigeon. Any of the stretches we covered are on the outline. My expectation is those are the only ones you're looking up right now. Okay? So I don't want everybody doing this. Somebody's going to come in, oh my God, I tried the one on the freezer that you told me, and I just totally tore out my hip. I herniated my disc, doc. You told me to do this. No, I didn't. It's recorded, right? But so only those 3. But I think with the stretching that you're doing, you'll be fine. You just need to consider the other movements that you're doing there. Like there's some movements you'll see me, I don't do them, or I do them a different way. When they have like a plank position down here or whatever, what did they do the other day? There was something they were doing, and it was like, like when they do the rows, I never do a row, I'll do it, because I have the option to do it this way, so I'll do it this way. Like the dumbbell rows, sorry. When they do the dumbbell rows, if I just rode like 1,000,000 miles, like 600 meters or whatever, I'm not now going like this, let's crank that forward head posture, even make it worse. No, I'm doing neutral.
Okay.
Dumbbells. So change up those exercises. Yeah, think about it. And that won't hurt you at all.
Okay.
That will not hurt you at all, I promise. And then some movement patterns, if you feel like your body's in a weird state, start walking or doing the strider or the bike versus getting on there. Because I only run and go all out once a week. I do like, I'm doing walking and I'm doing the little strider thing, you know. So, Val, one more, and then I'm gonna give password, let everybody go. Do you have one? No. Okay. All right. Any more? Going once, going twice? Okay, one more. She said sorry. She kind of deserves it because she was.
Okay, so I know you said it depends on your body as far as like how many you do, but in terms of like, let's say for a beginner, an intermediate, or advanced person in the gym.
She would do it perfectly, right?
Is there too many exercises for like, let's just say a muscle group such as like my hamstrings? Like, should I be sticking into like 2 or 3 exercises for that at a time, or like can I do like 5 or like what?
Yeah, so people think go to the burn, right? Like that's what people normally think. You know, I think that based on your rep count, let's say you're doing 10 to 12 to 14 reps. That's pretty darn good. You do 3 sets with stretches in between of 10, 12, or 14 reps, you're gonna be, again, as Killian Breen would say, shot after that. I mean, you're gonna be toast. You should be, if you're doing them right and you're doing them controlled. You get that?
Yeah.
So,
yeah, because it just feels like really short. You know what I mean? Of like what I would normally do. So I'm
well,
trying
no,
to, like,
you're not doing that. That's not your entire lower body workout. That's just like an example of one muscle group. So I might do 2 muscle groups. Like if I'm doing chest, I would do incline. Okay. I would do incline and decline, dumbbell flies. You get that? If I was going to do arms, I would do 2 tricep exercises. I would do 2 chest exercises and 2 bicep exercises. And the stretching would be determined in between by where I thought my body was out of balance or not engaging in the moment. So like Dr. Williams will go in the gym, he's doing dumbbells. Oh, this feels a little weird. Oh, it's hurting here. I feel like I'm not engaging here. So I drop down and do a stretch. You get that? I'm kind of streamlining that for you because you guys aren't there yet. But even streamlining it, you'll become more aware. That's what I'm getting you to really identify and learn as you do, as we unsubluxate your body and we work on this emotional part of going within. You actually, when you go inside and you learn more about you, you become more aware. Anybody think that's true of your body? Some of you are like walking through and you could run in a wall if your best friend didn't tell you that there was a wall right there. Like seriously, because we're all hooked up to TVs and phones and all that stuff. Okay? Does that make sense though? Did I answer your question?
Yeah.
So
it's like 2 per muscle group usually, like 2 bicep exercises,
and
2
so
tricep exercises.
What I would say for you is if you're going to do arms, I would just do back, biceps, and triceps, and then maybe core. And that would be a good movement pattern. If you did that interval and you did that fast and reps and you lined up all the kind of the stations for the different movements you were doing, you should be able to easily get that done in an hour and feel really good and have a really good pump, but really feel like the muscles were activated more than just pumped. Because that's lactic acid that gave you the pump. Get that? All right, guys. Well, thank you so much. God bless you. Really appreciate your time tonight. And have a fabulous night next month. Look out for the dates. Mark your calendar right now. And let's start getting people here and telling people about this. We'll have the sign-up sheet for next month tomorrow. God bless you. Thank you so much. Take care.
But the voice of truth tells me a different story. I will choose to listen.